Chapter 2, Section 4, Reciprocal Functions. Often, the sympathetic and parasympathetic systems will innervate the same organ. For example, the heart has both sympathetic and parasympathetic innervations that function reciprocally to regulate heart rate, conduction velocity, and the force of contraction or contractility. So, for example, the SA node has beta-1 receptors that, when activated, will increase rhythmicity, and has muscarinic receptors, on the SA node, which will diminish rhythmicity. Beta-1 receptors on the AV node will enhance conduction through that node, whereas muscarinic receptors on the node will diminish conduction through the AV node. Beta-1 receptors in the myocardium will enhance cardiac contractility, whereas muscarinic receptors on the atria will diminish contractility. The smooth muscle walls of the GI tract and bladder also both have sympathetic innervation, which produces relaxation, and parasympathetic innervation, which produces contraction. So, for example, smooth muscle walls are relaxed via alpha-2 and beta-2 stimulation and contracted via muscarinic stimulation. The sphincters are contracted via alpha-1 stimulation and relaxed via muscarinic stimulation. Saliva actually does not have reciprocal innervation, such that saliva production is enhanced by both beta-1 or sympathetic stimulation and muscarinic or parasympathetic stimulation. And gastric acid and pancreatic secretion are both facilitated via muscarinic activation without a direct sympathetic innervation. The radial muscles of the iris are responsible for dilation of the pupil, mydriasis, and have sympathetic innervation. So, for example, alpha-1 activation will dilate the pupil, whereas muscarinic activation works in a different group of muscles, the circular sphincter muscles, to constrict the eyes. The ciliary muscles will dilate to facilitate far vision. This is a beta response, a beta adrenergic response, whereas they will contract for near vision, and this is a muscarinic response. The circular muscle of the iris is responsible for constriction of the pupils and has parasympathetic innervation, as seen in the previous slide. In this example of the eye muscles, different muscles control pupil size, but the overall effects of the sympathetic and parasympathetic activity are reciprocal. In the male genitalia, sympathetic activity controls ejaculation and parasympathetic activity controls erection, which together are responsible for the male sexual response. Most organs have both sympathetic and parasympathetic innervation. These innervations operate reciprocally or synergistically to produce a coordinated response. The following three examples further illustrate the reciprocity and synergism of the sympathetic and parasympathetic divisions. Sinoatrial node. The autonomic innervation of the sinoatrial or SA node in the heart is an excellent example of coordinated control of function. The SA node is the normal pacemaker of the heart, and its rate of depolarization sets the overall heart rate. The SA node has both sympathetic and parasympathetic innervations, which function reciprocally to modulate the heart rate. Thus, an increase in sympathetic activity increases heart rate, and an increase in parasympathetic activity decreases heart rate. These reciprocal functions are illustrated as follows. If there is a decrease in blood pressure, vasomotor centers in the brainstem respond to this decrease and produce, simultaneously, an increase in sympathetic activity to the SA node and a decrease in parasympathetic activity. Each of these actions, directed and coordinated by the brainstem vasomotor center, has the effect of increasing heart rate. These two effects do not compete with each other, but act synergistically to increase the heart rate, which helps restore normal blood pressure. The urinary bladder is another example of reciprocal innervations by sympathetic and parasympathetic divisions, as shown in Figure 2-4, also found on page 55 of your book. Here we have sympathetic lumbar innervation to both the body of the bladder on the detrusor muscle as well as in the sphincter. The detrusor muscle has beta-2 activation, and when these receptors are activated, it will become relaxed. Alpha 1 activation of the sphincter will constrict the sphincter. Both of these will act to retain urine. In contrast, there is sacral innervation from the parasympathetic nervous system towards the bladder, both using muscarinic activation. Muscarinic activation of the detrusor muscle will cause it to constrict, and muscarinic activation of the sphincter will cause it to relax. Both of these will act to facilitate urine output. In adults, micturition or emptying of the bladder is under voluntary control because the external sphincter is composed of skeletal muscle. However, the micturition reflex itself is controlled by the autonomic nervous system. This reflex occurs when the bladder is sensed as being, quote, full. The detrusor muscle of the bladder wall and the internal bladder sphincter are composed of smooth muscle. Each has both sympathetic and parasympathetic innervations. The sympathetic innervation of the detrusor muscle and the internal sphincter originates in the lumbar cord L1 through L3, and the parasympathetic innervation originates in the sacral cord S2 through S4. The bladder is filling with urine. Sympathetic control predominates. This activity produces relaxation of the detrusor muscle via beta-2 receptors and contraction of the internal sphincter via alpha-1 receptors. The external sphincter is simultaneously closed by a trained voluntary action. When the muscle wall is relaxed and the sphincters are closed, the bladder can fill with urine. When the bladder is full, this fullness is sensed by mechanoreceptors in the bladder wall, and afferent neurons transmit this information to the spinal cord and then to the brain stem. The micturition reflex is coordinated by centers in the midbrain, and now parasympathetic control predominates. The parasympathetic activity produces contraction of the detrusor muscle to increase pressure and eject urine, and relaxation of the internal sphincters. Simultaneously, the external sphincter is relaxed by a voluntary action. Clearly, the sympathetic and parasympathetic actions on the bladder structures are opposite. The sympathetic actions dominate for bladder filling, and the parasympathetic actions dominate for bladder emptying. Pupil. The size of the pupil is reciprocally controlled by two muscles of the iris, the pupillary dilator or radial muscles, and the pupillary constrictor or sphincter muscles. The pupillary dilator muscle is controlled by sympathetic innervation through alpha-1 receptors. Activation of these alpha-1 receptors causes constriction of the radial muscle, which causes dilation of the pupil or mydriasis. The pupillary constrictor muscle is controlled by parasympathetic innervation through muscarinic receptors. Activation of these muscarinic receptors causes constriction of the sphincter muscle, which causes constriction of the pupil or miosis. For example, in the pupillary light reflex, light strikes the retina and, through a series of CNS connections, activates parasympathetic preganglionic nerves in the Edinger-Westphal nucleus. Activation of these parasympathetic fibers causes contraction of the sphincter muscle and pupillary constriction. In the accommodation response, a blurred retinal image activates parasympathetic preganglionic neurons in the Edinger-Westphal nuclei and leads to contraction of the sphincter muscle and pupillary constriction. At the same time, the ciliary muscle contracts, causing the lens to round up and its refractive power to increase. Reciprocal functions, sympathetic and parasympathetic. There are some notable exceptions to the generalizations of reciprocal innervation. Several organs of the body have only sympathetic innervation. For example, sweat glands, vascular smooth muscle, pilomotor muscles of the skin, liver, adipose tissue, and the kidney. Coordination of functions within organs. Coordination of function within the organ systems as orchestrated by the autonomic nervous system is another recurring physiologic theme. This control is exquisitely clear, for example, when considering the function of the urinary bladder. In this organ, there must be a timely coordination between the activity of the detrusor muscle in the bladder wall and in the sphincters. See Figure 2-4. Thus, sympathetic activity dominates when the bladder is filling to produce relaxation of the bladder wall and simultaneously contraction of the internal bladder sphincter. The bladder can fill because the bladder wall is relaxed and the sphincter is closed. During micturition, parasympathetic activity dominates, producing contraction of the bladder wall and simultaneously relaxation of the sphincter. Similar reasoning can be applied to the autonomic control of the GI tract. Contraction of the wall of the gastrointestinal tract is accompanied by relaxation of the sphincters. This is a parasympathetic response. This allows the contents of the GI tract to be propelled forward. Relaxation of the wall of the GI tract is accompanied by contraction of the sphincters, and this is a sympathetic response, and the combined effect of these actions is to slow or stop movement of the contents of the GI tract. That concludes Section 4 of Chapter 2.